80% of Americans will have some back pain at some point in their lives. Tracy is one of them. She's tried everything she can think of. Nothing seems to help. What we did today is we're showing her a cutting-edge alternative pain treatment. This is called cupping with Dr. Michael Yang, who practices this, so don't do this at home. Now Tracy, how's your pain?
My pain? It was bad. It's feeling just like suction on my back right now.
Well, and this is so intriguing, Dr. Yang, because you're literally creating suction, and instantly her skin and I'm assuming all that tissue underneath is being pulled up into these bottles. So how does this work?
I mean, that's exactly it. It works on similar principles as having a deep massage done, so you're actually right on it. You're separating some of the tissue layers, so the skin, the fascia, that connective plane, and the musculature are spreading out a bit, so you're getting increased circulation, decreased inflammation, and that's sort of very similar to what you'll see in typical kind of physical therapy. So it's part of a greater physical therapy protocol. We're not going to do it on its own. It's going to be in combination with acupuncture, with stretching, with strengthening, with core techniques, especially with somebody who has a lower back history.
And this is a good option for someone with what we call musculoskeletal back pain.
Exactly.
And I want to show people really quick on the skeleton. You know, all these vertebrae make up your back, and typically when people injure their back, what happens is the muscles, they're called the paraspinal muscles that line the skeleton, they typically get tweaked, pulled, stretched, and it can be something as simple as picking up the grocery bag.
Typically, it's the bending and the twisting that's problematic, and when people have good form and they have good, strong backs, that's not an issue. What we just did there was a combination of acupuncture with the cupping, so you can actually see the needle inside the cup. And what's interesting is that although my specialty is Chinese medicine, what you're seeing, this type of thing, I have patients that come in from Mexico, they talk about how, oh, my grandmother used to do this. I have patients that come from the Middle East, my grandmother used to do this. So it's really a tried and true therapy. Like I said, as a portion of another kind of greater physical therapy program, it can be very, very effective.
But I want the camera to zoom in on these up here because you're literally bloodletting.
We're doing, okay, it's not like medieval bloodletting. Hold on a second.
But come on, look at this. There's blood all I'm sorry,
right,
Tracy, but there is.
It's not all over.
It's somewhat frightening looking.
Okay, watch. Simple lancet device, something that maybe a diabetic is familiar with. You put a couple little, 1, 2, 3, 4.
Does that
tiny,
hurt? No, not at all. Okay.
Doesn't hurt at all. We combine that with the cupping, and what we're doing is we're getting a little bit more effective treatment, right? So we're mobilizing more of the lymphatic cells, a lot more activation, and you're going to see some of the blood being drawn up into the cup. It's not like that medieval thing when we're talking about milliliters and milliliters and, you know, a pint or two of blood. It's a tiny bit, less than a teaspoon. You can see that right here. And she's going to get up and she's going to feel much, much better. One of the things that I'm sure you emphasize to all your folks who come to visit you, the key to preventing back pain is a strong core. Always, 100%.
And so sit-ups, exercises that strengthen your abdomen will actually strengthen your...
Getting off the couch is helpful.
Exactly, getting off the couch
is helpful, absolutely.
But prevention is the key, and this is, like you said, this is good for muscular problems. If you have such a thing like a slip disc or a fracture in your back, this is not the treatment for you, correct?
Well, I'll tell you what, it's a combination therapy, because even if you have a slip disc, even if you have a fracture in your back, there's going to be a muscular component to it. So you may want to go to your surgeon to get the procedure done, say go in for a laminectomy or some type of surgery, but there's also going to be stuff that's going to be soft tissue related. So again, as a combination therapy, that's when you're seeing the best results.
But you're feeling good, right?
Yeah, it doesn't hurt at all.
I mean, it looks like you got attacked by an octopus, and this is going to last. The marks are going to be on her for about maybe 3, 4, 5 days maximum. And what's funny is that the more you get the procedure done, the less the marking lasts. The Chinese talk about detoxification and moving stagnant blood. They talk about stagnant blood being the cause. And when you get some of this pricking done, a lot of the times you're going to see really dark blood come out. And after a few sessions, the blood actually changes color, and it's going to come out really fresh and red. And ultimately, that's how oftentimes you'll know that it's working effectively.
Well, Tracy, thank you for being on the show.
Thank you.
Thank you. Always fun to have you on.